The new initiative by the National Department of Health, making HCT more available to everyone, has really been a positive move.
South Africa government guidelines on HIV counseling and testing are now including the fact that anyone can come into a clinic for any reason and test.
Testing for HIV through X, it is a gateway to more HIV care linked to ARVs, support groups.
So it really becomes a burden if you detect HIV at a late stage. Also financially, it impacts the healthcare system tremendously if you have to treat people once they're on stage 3 or 4 of HIV and AIDS.
HIV is a medical disease, and the healthcare system must step up to do its part to make HIV testing routine.
As a healthcare professional, it is your duty to ask people to come for testing. This is what ACTS is supporting, this is what ACTS is wanting to do, and I encourage that.
Every day across the country, using the traditional approach to voluntary counseling and testing for HIV and AIDS, that has caused thousands of people to come in and out of our facilities who do not know their status.
We designed ACTS as a streamlined system so that every doctor and nurse can offer HIV testing in all their medical encounters with their patients.
ACTS is really a great tool that has helped us in our country's health facilities to add HIV screening to our routine services.
I was very skeptical because thinking like most nurses, we already so overburdened, seeing this as more work because we were used to the long model of doing HIV counseling and testing.
In the X model, you get rid of those what ifs. You just assess if the person is ready to do the test and advise the person about the testing, and you go straight into the test.
At that stage, I was working in the TB room, doing all the TB suspects that morning. I've offered them the HIV counseling and testing approach of the X model. The clients loved it. For number one, they didn't need to go and sit in front of a counselor's room where everybody know what they are coming for. So people left there, and it opened the doors for us to get more people tested, because people go and they spread the word that you don't need to wait so long to get tested anymore.
And we just saw it as a perfect model. We would be able to reduce the time that we spent with our clients versus a 40-minute pre-test counseling session and a 20-minute post-test counseling session.
Nurses saw positive patients as creating an extra workload, more than just the counseling and testing. But once I started the process and I became structured in the way I deal and my systems were in place, it took as long as anybody else that you'll admit, whether it's a TB patient starting something, an asthmatic, a diabetic, any other category of chronic diseases.
I've never had any client regretting for doing the test and wanting to know own status.
We yielded results like we never thought possible. We practically tripled the number of clients we could test within 1 quarter.
When the government heard about what a great job they did and they saw the numbers of youth that were coming in, they've asked ACTS to spread out all over the province.
It is innovative. It destigmatizes HIV. So I've seen clients who are starting ARVs, getting well. I've seen clients who know their HIV status, staying and living positive.
This is an angle where I can do so much more for my patients by training nurses and opening up their minds to offer this product to each and every client accessing healthcare so that it becomes beneficial for both parties.
ACTS has really helped us to see our clients in a more holistic manner and treat them comprehensively.